I think we'll go ahead and start. My name is Coleman Cutchins. I'm a clinical pharmacist with Mountain Pacific Quality Health, and I am in Alaska. So when I thought about doing a presentation on vaccination, originally I was going to go through recommendations and go through guidelines, but today instead I'm going to tell you a story about how a model for partnership worked to expand flu and pneumococcal vaccination, and how we can actually apply this to many different scenarios. So today, kind of the overall view of this is we're going to identify barriers to vaccination services in disparate populations and what they may face. And we're going to talk about how student pharmacists and actually students of any medical professionals can work within an interdisciplinary team and can assist those in need. So where really all of this started from was we wanted to increase access to vaccination for high risk and high need population. So here in Alaska, we have a new College of Pharmacy. It was established in 2016, so the first class is in their fourth year of the four-year Doctor of Pharmacy program. It's a distance campus with Idaho State, so it's the UAA, which is University of Alaska Anchorage, ISU, Idaho State University Doctor of Pharmacy program. So I'm on the academic advisory committee, and I've been advising for experiential education. So we've been looking at opportunities where we can expand the role of students. So it started with a conversation between the dean and I, and we were like, where can we really get these students involved? Because I've always been a very large advocate of the sooner we can get, pharmacy students, nursing students, medical students, PA students, any medical professional student involved with patients and experiencing patient care and talking to patients, I think it's better off for the long run because they are the future of our profession. So I added an extra slide in here because I realized that, anytime I talk, I like to talk about Alaska. So in Alaska, Alaska is pretty much almost as big as the lower 48. If you look at the spread, if you put us over the lower 48, we would cover from Jacksonville all the way over to San Francisco and then almost up to the Canadian border in Minnesota. Another thing that, and this will be relevant later, we talk about is the road system. We don't have very many of them. So this is pretty much the roads we have in our entire state. Only about 17% of the communities in the state are connected via roads. And these are kind of the main hubs and where the roads go. So I'll talk about, again, where we've targeted and what we've done with this project. And then the other fun thing I always like to put up anytime I talk about Alaska is, this is our map of the United States. It sits in our visitor center in downtown Anchorage where we're big, and then the lower 48's there, and Hawaii's as big as the lower 48. So hope you guys get a kick out of that. So phase one, where did we go? So in the discussion with the dean about talking about where students can be effective, about 4 years ago when they were fourth-year students, the Anchorage School District, through cutting funding, used to give vaccines at, I'll go to my next slide, at all the schools. So my kids would come home with a permission slip saying, do you allow your kid to get their flu vaccine at the school? And we would fill it out and say yes. And then at some point during the school day, kids would be pulled out of class. They'd go to the school nurse and they would all get their flu vaccine. So then a change was made, I think it was 4 years ago now, where the flu vaccines were moved to centralized select schools. And they were given on the half days during the afternoon parent-teacher conferences. So I was actually sitting in line at the high school where my kids had to go, and this was when both of my kids were in elementary school, and the line was like 30, 40 minutes to get their flu vaccine. So we're sitting in the line, we're waiting in line, and I don't know if I mentioned this, but the state up here supplies all childhood vaccines, so we don't have to deal with where we get the vaccine from. It comes from the state. We don't have to bill insurance. It's pretty easy. So we're sitting in this line. We finally get to the top, and I realize that there are 2 school nurses giving vaccines to a lot of kids. So at this moment, I thought, wow, well, how about if we get some partners together, get a hold of the College of Pharmacy and the College of Health so we can get nursing students, pharmacy students, PA students at least in here. And worst case scenario, they're going to have a bunch of free labor to get these vaccines done a lot quicker. So I made some calls and we started reaching out. And then what we realized, if you think about it, is the school vaccination rates went pretty far down because the only kids that could get their vaccine in this model are the ones that had transportation to get to one of these other schools where they were giving the centralized location. So we actually started with the Title I elementary schools. So we did students and staff, and we went to the schools during the school day, actually at the very end of the day, with a team of students and preceptors so the students could give vaccine. I also came up with an education to educate fourth grade and up in their health class on the importance of vaccination and vaccine preventable diseases. And then within some of the communities, we came up with a really neat program where kids were encouraged to bring their auntie or uncle to get vaccine. And in these communities, we have a lot of, a really strong sense of community. We have a lot of Southeast Asians population. So it's, Cambodia, Filipino, Vietnamese, and they have, any elder, and also the Pacific Islanders, if it's an elder, it's an auntie or an uncle. So we taught the kids during the health class too on the importance of, keeping auntie and uncle safe and bringing them in for the vaccine. So we did this with our Title I schools. Same thing, we brought them in and brought a bunch of pharmacy students and gave vaccines. So from there, child vaccine was provided by the state. So that was pretty easy. The adult ones were a little bit more complicated. We actually had some volunteers come in that could bill through a community pharmacy. So they billed the third party for adult vaccine. And then we didn't have numbers on the family members and that we vaccinated, but from this, we estimated that we gave 3 times more childhood flu vaccines with the schools piloted than received the year earlier when those kids were having to go to a centralized school and get transportation there. And we gave 174 adult vaccines to family members. So from there, we started looking at it and we said, wow, this is a really successful model where we can, educate the community, we can educate children, we can educate adults. So what other vulnerable populations are there out there with similar barriers? Kids can't drive themselves to get their flu vaccine. So who else can we look at? So from there, 2 years ago, 2 years ago now, we looked at assisted living facilities. So for assisted living facilities, we don't, in Anchorage and in central Southeast Alaska, we have a pretty big access barrier to skilled nursing and assisted living. And most of our assisted livings are very small. They're very isolated, 1, 2, 3 residents. They're not kind of the big industrial assisted livings like I've seen in other parts of the country. So just some background, when we're thinking about assisted living, we have about 100,000 adults in the U.S. die of vaccine preventable disease every year. And about 70% of those deaths occur in people 65 and older. And, we estimate about 1 in 3 seniors, they don't get their annual flu vaccine. So when we talk about assisted livings, we have about 650,000 elders living in assisted livings. We have 659 in Alaska. Again, almost all of these are very small. Based on GIS mapping, a lot of our assisted livings are in poor, poverty, and vulnerable areas. 44% of those are in places that are below the national poverty line, and 38% are in racially diverse communities. Also, too, many of our assisted livings are not connected to public transportation. Only 4% of assisted living residents still drive. We'll talk a little bit more about access to transportation. So what did we do? We took our model of going to you for flu vaccines and we applied it to assisted living. So our objective is we wanted to improve vaccine access for assisted living residents through on-site vaccination. And overall, what we'd like to do then is reduce the incidence of preventable disease transmission through a no-cost, volunteer-driven vaccination of assisted living residents, family members, and staff. So we didn't do just the residents, we also did the family members. They're the ones who come in and out and have contact with the residents, and the staff, same way, have contact with these residents as well. So our intervention was that the College of Pharmacy student-led organization, there, the American Pharmacists Association has an Academy of Student Pharmacists, and they have an Operation Immunization designation. So the pharmacists working through this partnership with American Pharmacists Association worked out, and we also partnered with state HHS, the College of Pharmacy, the College of Nursing, the College of Health, the Pharmacist Association and the Nursing Association to get preceptor volunteers, as well as the Providence Foundation, a big nonprofit foundation through the Providence Health System. So then we used this multidisciplinary team of volunteers and providers. We precepted students administering vaccines, and we gave flu and pneumococcal vaccines first is what we targeted. So this was an established program. We just kind of made it bigger. I don't know if I made that clear. Well, it was a pilot program that was started a few years ago through Providence Foundation. So what we do is one weekend we take nursing students, PA students, and pharmacy students, put them out in vehicles with one preceptor and 3 students, and set out across the community. For this one, we didn't want to deal with third-party insurance. In the past, they'd done it, but when the QIO and the College of Pharmacy gotten involved, we set up donations. So Providence created a Get One, Give One campaign, where for all of their employees within the hospital and their clinics, when they got their vaccine through employee health, the foundation donated a vaccine to the Get One, Give One campaign. So all vaccine was donated, which made it easier, and this was done through a volunteer basis. So now what do? We get in the car and we drive. So here we have, this was actually on their way to the event. So the young lady in the front seat is a PA student, and the 2 in the back are pharmacy students. And then from there, where do we drive? We drive into the homes. So these are some pictures of the assisted livings that various people went and visited. So not like you think about giving in a clinic setting. And then once we were in the home, we gave vaccines. We gave vaccines at dining room tables. We gave vaccines on living room couches. We gave vaccines pretty much wherever anyone would let us give a vaccine. And then the students documented everything that needed to be documented for our state vaccine database, VacTrack, and then later it was put in, all the information was put into VacTrack from volunteers at the College of Health. So what did we get for success here? So the involvement of the pharmacy students and the College of Pharmacy in the expansion of the project, we increased the number of vaccinations we gave by 46%. That is last year in 2018. However, despite that increase, we still were only able to reach 24% of the assisted livings in the community. And that's the community of just Anchorage. So basically, what did we learn from all this? We increased the numbers of assisted living that we visited through expanding the collaboration and the partners. To ultimately increase the number of older adults who get their vaccines. So, vaccine preventable disease, especially influenza, is a large morbidity and mortality contribution for the patient population we're dealing with in seniors as well as assisted living patients. We're also expanding access for vaccines. We're bringing the vaccine to the people. So overall, we're improving population health looking at this model. So our overall conclusion of how this worked is, like I said before, health professional students are the future of healthcare. So when we increase the quality of educational experience and patient interaction while they are students, it's extremely valuable to their long-term contribution to healthcare. So educational organizations and stakeholders should continue to seek out opportunities working together and increase access and benefit from valued student contribution. So from there, I'll mention that we've, since this model was successful, we've moved out and used the same model of precepting students and sending them out for things like diabetes classes, chronic disease management. We've done a lot of health fairs for point of care testing. So it's really a good model to help utilize our services and get people together for projects that are successful. So from that, the college does now have their Operation Immunization certification, which is prestigious for the university, and it also helps them have more access available to resources and things like that through the American Pharmacists Association. So the next thing we're doing is this year we're actually expanding. So, I showed this map before of where our roads are and how far everything is apart. So just to kind of put things into perspective, the little junction just above Anchorage is Mat-Su Valley, which is really considered a suburb of Anchorage, although it's 50 miles away. So really from there until you get up to Fairbanks, there isn't a whole lot. So when you look at the borough above Anchorage, the Mat-Su, Denali boroughs are roughly half the size of Wyoming, with a little bit less than 100,000 people, one hospital, and one main emergency medical service location. So we get really spread out and we get really sparse. Now, the other thing, when we talk about the next community north, up here in Wasilla, Palmer, Houston, Willow, Sutton, this whole area is considered the Mat-Su Valley, and it goes way farther north, is this is where all of our affordable housing is moving. So to expand our mobile vaccine clinic to assisted livings, it made sense to go north. The bad news is, it's about 45, say almost 50 miles city center to city center. There isn't a whole lot in between. So this year we are deploying our teams out of Anchorage for a second weekend to do assisted livings up here in the valley. And we hope to see similar success rates with increasing vaccination up there. So overall, like I said, I cut this short. I really left it open for discussion because there are a lot of things that go into a project like this with vaccination. And we did have some barriers and we did have some challenges along the way. And we did learn from a few things that we've done. So at this point, I'd like to unmute the phone lines and monitor chat and see if anybody has any questions.
So Coleman, this is Amber. I have a quick question. So I know that Alaska is a mandatory immunization registry reporting state. I'm assuming that the students do not have access to the EHRs because assisted livings specifically there don't have an EHR oftentimes. Who does the connection then to the registry?
So that's a really good question because we are mandatory reporting to our state. It's like I said, it's called Backtrack. So the students actually did all the necessary paperwork on paper, and then the College of Health does have a login to Backtrack. So and actually now they have a second one because of this pilot where the College of Pharmacy do have their own. They had to pay for it. They have their own access to Backtrack, so they can submit information into Backtrack. So whenever they got, the first year we did it, none of that was set up. And there were some volunteers through the Providence Foundation that used a login from one of the clinics, and they entered all the information into Backtrack. And then the College of Health got their own last year, which was the second year. And then same way, one person did it for all of it, but it was kind of a lot. And then now for this year, the College of Pharmacy have their own login as well. And so they're actually submitting their own information to Backtrack.
Awesome. And then Kimberly just put in chat about, she asks, how many students are in a class? Do they get class credit for participation?
So with the College of Pharmacy, it's been a ramp up. So we have 15 seats. It's a 4-year program. We have 15 seats. The first class, who are now in their 4th year, only had 5. So the inaugural class had 5, and then the second class, who are now in their 3rd year, had 9. But then the 3rd and 4th class each have 15. So it's been a ramp up process. The PA program, I believe, has 30. I should know that. I lecture for them from time to time. The medical students are, I believe, 20. They weren't involved in this program, and the nursing students is, I believe, 40. So we have quite a few students. Now, from speaking from the pharmacy side of it, they don't get class credit, but they do get credit for outreach. So as required by all College of Pharmacies, you have, they're called IPPEs, Introductory Pharmacy Practice Experience. And those hours usually consist of, it's different from school to school, but it's approximately 400 hours over their first 3 years, and schools do it at different times. The college up here have a mandatory 80 during their first year, and then the rest of it is spread out with community outreach projects like this to get the rest of their hours. And then their 4th year is entirely done with rotations, and those are called APPEs, Advanced Pharmacy Practice Experience. So the students were doing this as part of their outreach, required outreach education hours. And certain of them have to be done in outreach things like this, and some of them have to be done in a hospital setting, and some of them have to be done in an ambulatory care setting. So does that make sense?
I think so. Kimberly, just type in if you have another question about that. And then Kimberly also asks, how did you notify the residents for the assisted living that you were going to be in the area? I'm sure with the school age, that's, if it's still parent-teacher conferences, the school takes care of that. But was there any materials that kind of were effective?
Yeah, so, and we're actually working on getting this better. So we reached out to all of the assisted livings through how they were registered with the state. So we actually sent out mailers, and it's going to change a little bit too. I didn't mention this, but actually the College of Pharmacy is taking over this now. So they are the leads on this project starting this year. So we found all the assisted livings that were registered within Anchorage and now within the Mat-Su Valley. And we sent out letters saying that, hey, we're going to offer this service, because we also wanted them to notify family members of the residents as well ahead of time. And Mountain Pacific, we did some of the, I did a lot of packaging envelopes, putting letters in envelopes and licking them, and then taking them back to get sent out. So we sent out letters letting them know the dates that we would be available. And then also they had to respond. We didn't just show up at their door, that they would be interested in an approximate count for residents, so we knew how much vaccine to bring. So then from there, if we didn't get a response, we kind of dropped it. Obviously we couldn't babysit them. So and we had to know ahead of time how much vaccine to bring.
Awesome.
So that's how we did that and let them know. I'm just trying to look at some of their chat.
Coleman, I didn't realize that I could use you for my administrative assistant duties. I'll put that in my on my list of to remember items. We do have another question from Kevin that asks if there was any logistical or credentialing problems in using students.
So no, because again, since it's done under educational hours, they are all covered by the university, and they're covered by because they're out there doing experiential education. And then the preceptors have to fill out a form with the university, saying that, yes, I'm credentialed to precept students, and yes, I'm vaccine certified and those things. So that part is all handled under the experiential education department at the university. The only other thing that we had a little bit of a gray area on, and we had, is them using their own vehicles. So basically, we just had to have them sign forms that said, I understand I'm in my own vehicle, and if I get in a wreck, it's my fault, basically. But I think that was kind of an extra step above and beyond to cover liability.
Okay. And then just a couple of questions about payment. So for the schools, I totally get the fact that that's Vaccine for Children's support. But what about for the assisted living? How was there billing involved in that?
So for the assisted living, it's all donated. So we've done that all, like I said, through the Get One, Give One campaign. And it's all donated supply.
Or is that just donations, or?
It's done through the Providence Foundation. So the Providence Foundation have donated, and again, that's the nonprofit foundation wing of Providence St. Joe Health System. So they've done the campaign where, for every employee who gets a vaccine, they will donate a vaccine. You just have to, as an organization, apply and ask for that donated vaccine. So we had to write a request to Providence Foundation saying that we're going to need this much flu vaccine and this much pneumococcal vaccine approximately, and the supply was there. Now, if we couldn't get enough vaccine, or if we get to the point where we're giving too many of these, then we'll have to look down other avenues. One of the lessons learned from the phase 1 where we went into the school district and we vaccinated family members was we didn't have donated vaccine for adult there. So it was complicated with taking third-party insurance information and getting reimbursed, and it made things a lot more complicated. So that's why when we moved on to this phase, we looked at how, and a lot of assisted living people would be Medicare, Medicaid, but even in that level, we kind of went more towards the avenue of how do we get rid of the third party and not have to deal with that part of it, if that makes sense.
Yep, that totally makes sense. How about, is there any partnership with public health?
So the state HHS department really helped us figure out how we can get a hold of the ALFs. We were originally going to reach out to them using the registration, how they're registered with the state, and they've been a big supporter of us. And I think if we ever get to the point, or if we get to the point where we can't get enough vaccine through Get One, Give One, the state will probably help us out, but we're not sure on that. But they've been a really big partner.
Okay. Here's another loaded question for you. We talked a little bit about closing the loop to the immunization registries, but how does the information get back to the patient's primary care provider to close that loop on the primary care provider's end?
So it does go into our state registry. So, I mean, that's a great question, because we actually even threw it out there. Like, I have a couple other projects that we have in the works here that would have to take into more consideration, care transitions and information flow across those care transitions. And now the other thing we're running into up here, and we actually asked a lot of these questions, is at least in Alaska, most people do not get their flu vaccine from their primary care provider. They get them from pharmacies. So, then it gets even more complicated, because where are they going to go to get their flu vaccine? It may be a spur of the moment where they're shopping in their grocery store and they notice a flu vaccine sign and they walk over and get their flu vaccine. So we really thought about that. Do we find out who their primary care provider is and send them a note? We've done that when we've used at health fairs, when we're using students to do point of care testing for things like lipids and A1Cs. We'll take down the information for their primary care provider or any of the other providers if they have a cardiologist and an endocrinologist also. And then we'll fill out it's more of an FYI form that, hey, your patient was seen on this day at this health fair, and we did a point of care A1C, and it was this, kind of as an FYI, because I don't feel that those can really go into an official medical record and be used as official labs. It's more for, patient education and empowerment. So we really debated doing something similar to that with these flu vaccines. But in Alaska, what we really fell back to is, wait, we have a state registry and we have mandatory reporting. So really, before anybody gives a flu vaccine, be it a primary care provider or a pharmacist in a community pharmacy, you know, or anybody else, they're supposed to check the vaccine registration to make sure that they haven't already gotten it. So that was kind of our rationale behind that one. I don't think it's a perfect model. I mean, I know the years that I was in acute care, I always checked the vaccine registry before I gave vaccines, because it's amazing the patients who will tell you, no, I haven't received my flu vaccine yet. And you check the registry and they got it 10 days ago, you know, so that was kind of our fallback, is that they should be checking the registry. Now, are there some residents who possibly got two flu vaccines? You know, possibly, but for us, and all the discussion, that was the best we could come up with.
Yep. Well, that makes sense, because, you know, people have to do that. I mean, most clinics, I don't know if they would necessarily trust a little sheet of paper that was faxed to them from some unknown number too. So that kind of makes sense. So we're kind of back to another question, back to the school system. And when you were doing that with that parent-teacher conferences, and the question deals with vaccine hesitancy, about how do you approach parents who are hesitant in vaccinating their kids?
So in Alaska and in Anchorage, we don't have that social vaccine hesitancy. You know, in other outlying communities, there is quite a bit of that for different reasons. But I think, for more or less of a better way to explain it, we've sort of been blessed that we don't have that anti-vaccine culture here in Anchorage. You know, we did the child education ahead of time, and when we created that, we sort of, at a 4th, 5th, 6th grade level, debunked a lot of the vaccine myths. You know, my favorite vaccine story around anytime I talk is my son, who, when he was 4, went to a new pediatrician when we moved to Alaska, and he always hated shots. He still hates shots, and he's almost in high school. So he went in there, and he was so convinced he was going to get a shot, and the physician actually asked him if he was allergic to anything, and he said, yes, I'm allergic to needles because they make me bleed. So I always say that that's not a contraindication to vaccination. If needles make you bleed, that's still not a reason to not get your vaccine. But, you know, we proactively sort of approached it with the kids, I guess a roundabout way of me saying this. So hopefully, even if parents were vaccine hesitant, you know, the kids might be able to talk them out of it, but I guess that's not really a barrier that we've had a whole lot of here. I mean, I will say that my aunt is a she's mostly retired pediatrician in California, and she talks about the insanely high level of vaccine resistance that they have in the area that she is, kind of in the coastal Southern California area. And she kind of jokingly says that within those people and within their society and within their little social cliques, that there's such a social stigma saying that you vaccinated your kids. You know, she jokes that, you know, a lot of those people, if you telling them that you gave your kid a vaccine has the same level of social stigma as telling them that you just bought a rifle. So, but luckily we don't have that up here.
There was actually an article, and I cannot remember what journal. It was some women's magazine that talked about that, the fact that people are vaccine hesitant because of their social stigma. But on the positive, proactive positive peer pressure is the fact that if those parents are in parent-teacher conferences and they see everybody else lined up to get their vaccinations, there's a positive influence in seeing that everybody else is doing it too.
Yeah, that's a great point. That is. Now I will say in some of our outlying areas here, we do have vaccine hesitancy, but it's not due to the social stigma. It's more due to the distrust of, kind of the man and not wanting to be told what to do. But we haven't expanded it to those communities yet.
Okay. So we have another question, and keep them coming, guys, if you have other thoughts, or even feel free to kind of chat in something if you feel like doing that, or you can always open up your phone lines and just, give us a heads up that you want to have a conversation. But Maggie asks, back to assisted living, we make you go back and forth between patient populations, keep your brain limber. And you might have already addressed this, I can't remember, but was there a process for permissions and releases to get, no, that was a reimbursement question, sorry. The question was there a process, permission, release to give the vaccinations, and then how do you do the reimbursement? And you already answered the reimbursement question from the local foundation. So can you just address the permissions piece again?
Yeah, so within the assisted living, most of them are competent adults. Some of the patients did have decision makers or guardians. The few instances that I was aware of that came up, the nice thing was that they had a medical release on file with their caregiver at the assisted living that they were allowed to make kind of on the spot medical decisions. So that was kind of not a barrier, and the rest of them were adults. Within the school district, another thing that I don't know that I really stressed enough, and I think that looking back as, what was the best thing we did in the school district, I think, getting that sense of community and getting those maybe 4th, 5th, and 6th graders and helping them understand about how important it is, to get their community elders and the people who take care of them vaccinated. Because, a big push with that is, I really made the point that, in general, a lot of people kind of aren't afraid of the flu as they used to be, but, even 50, 60 years ago, it was one of the leading causes of death in our country. And flu is still extremely dangerous for, the very young population, the immunocompromised patient, and then our older population, especially those with, one or two or more chronic diseases. So we really pushed it as the way of, one of the best things you can do for, auntie or uncle is help them be healthy and prevent them from getting sick. And, and it was really cool to see the kids, bring their family in and be like, oh yeah, you're going to do this for me, and I really think that was a big benefit. Now in the school kids, if parents weren't present, we had to rely on them having a release form so they could do it ahead of time. But, when the family member was there, they just filled it out on the spot.
Okay, thank you. Any other questions from the group? Don't be shy.
And I'll also add with the vaccine resident registry, we did understand the importance of getting that information in there quickly. So the information, we did it over 2 days, Saturday and Sunday. And this year there will be teams of people like Saturday evening and Sunday evening entering vaccines into the registry. And the goal that we've set is that they're all entered in before the end of the day Monday. So that way it doesn't sit, or somebody go to their primary care provider a day or two later and it's not in there. So we are quickly getting it put in there.
That is a quick turnaround. And then Maggie has another question. If you wanted to, you've kind of mentioned a little bit about auntie and uncle, but do you have any other cultural perspective challenges?
Not right offhand, but I think this year when we go to the next community, up to the Mat-Su Valley, we probably will experience, some other cultural challenges and barriers, but we won't really, we haven't really approached it any differently. And I don't think we'll know until after our weekend is done. And this year we haven't scheduled our weekend yet because we don't have reliable vaccine in the state yet. That's one of our, it's interesting when we talk about flu vaccine in Alaska, and I know I've talked to our people in Hawaii about this as well, but Alaska and Hawaii are the two only states that consistently have year-round flu. And, I'm on all the public health listservs, and we've had consistent flu here for almost a month already. And we always have a scattering, at least one case a month year-round, thanks to all the tourism that we get from all over the world. And our flu season tends to be a lot earlier. Actually, our fall season, right now, my leaves are all changed and, half the leaves are off the trees in my yard. But we don't have flu vaccine yet. So we can't really schedule we should be giving it now, but we can't really schedule it until we have vaccine in hand. So that's actually a big challenge. And I don't know how we fix that because we're relying on the drug manufacturers to get us vaccine, but we really need it in September.
Back to your school program. Do you have any plans to expand the vaccination outreach to include middle or high school?
So and the school thing, we actually have another challenge with that is this year the school district was revamping a lot of their policies. So this year we actually weren't able to do the family members in the school. We're still doing the students and we're showing up to their events, but the hubs are almost all the high school. Every high school, when we look at it, our high schools were all the hubs for parent-teacher conference day. So if, your elementary school kid, you went to their parent-teacher conference at the elementary school, and then you had to drive them over to the high school to get their flu vaccine. So since the high schools are already getting them there, we aren't expanding it to the high schools because we're already there. And then in the middle school, all but one middle school is also a vaccine hub for the district. But I think when we talk about this year versus next year, I would like to expand it more to going there during the school day. I think that's the best way that we're going to get the most number of kids vaccinated.
Okay.
And so the interesting part too with the school district is when I went and met with the senior leadership at the school district, the big, I guess, selling point, for lack of a better term, as to why they really bought into this was absentee rates, because all of their funding, their state and federal funding is based on, I'm sure I'm butchering this, but based on how many kids go to school, how many days. So really, they were really resistant to, letting us come in and help with vaccines. But that was kind of the big point for them is, hey, you're going to have a lot less absences if your kids are vaccinated, both student absences and staff absences. So that was kind of the icing on the cake that made them agree to it, which is interesting,
Yeah, we actually have a couple of nursing homes in Montana that offer flu vaccines to both their, not only their employees, but also their employees' family, both kids and spouses, simply because they know that in the healthcare arena, then the family member that's working in the nursing home is probably the one that's going to call off sick to take care of everybody else. So, to decrease call-offs, it's a multi-pronged intervention. And we have another question. Somebody writes, what if the vaccine registry is down? What are the workaround processes then?
So, let me read it. What are the workaround processes for the vaccine registration? Mm-hmm. Is that what?
The registry.
Our vaccine registration, it's hard for me to remember a time when it wasn't mandatory. So I believe it's been mandatory since 2013. It's pretty easy to use. The other thing that really helps our vaccine registry is the largest EHR providers have two-way integration. So Epic Cerner Epic and Cerner are the two biggest ones nationally, but then also a lot of the clinic EHRs now have integration packages with Backtrack, so they don't even for clinics to use it and hospitals to use it and nursing homes, they don't even have to log out of their EHR. You know, they can just, when the information gets submitted into the EHR, it automatically downloads to Backtrack. And then they also have an external query where they can just click on a hot button in terms of informatics terms, and it pulls the information right into their EHR. So that alone, I know that that's really just geared up in the last 2 years. You know, when I go out and talk to providers and stakeholders and organizations, they have all really expressed the fact that that has made it so much less painful, and it almost makes it seamless in terms of dealing with Backtrack. I know the pharmacy softwares have the download capacity, but I'm unsure if, you know, the big chain pharmacies, the CVS, Walgreens, Kroger, have upload capacity if they can see it through, you know, query information out within their EHR system. I guess, did I answer the question?
That's okay. And then do you have any plans to pilot other vaccines, specifically the HPV, shingles, or pneumonia?
So we actually did pneumonia vaccine as well in the assisted livings. So we did flu and pneumonia. I think I mentioned that briefly, but we did both of those in the assisted living. We only did flu in the school campaigns for both the children and the families. My new push, and something I'd really like to see on the horizon, is really good campaigns for the expensive but very evidence-based effective vaccines like HPV. You know, the College of Pharmacy and I have it on our plan that once we get through this flu season to really aggressively approach the school district about HPV vaccination. And I mean, I have a lot of, you know, a personal battle, I think, with HPV, where I say, you know, I mean, if we really think about it, there should be no resistance to HPV. This is a vaccine that could essentially eradicate a type of cancer. You know, I mean, if we can do mass HPV vaccination, we're going to eliminate, you know, pushing 100% of cervical and head and neck cancers. Like, how can anyone be resistant to that? You know, think about it. If we said, you know, hey, we have a vaccine that can eliminate all breast cancers, all lung cancers, you know, I think that that's something that I really think, if you look at a public health perspective, you know, in a couple generations, we could get rid of that cancer, and that's a pretty big win. So that's really going to be our next push, I think, with these vaccine type partnerships.
I agree with you completely. And we have about 10 minutes left. Does anybody have any other burning questions or comments that they would like to have addressed?
So I will say too, Amber, I see you put it in here that, you know, Montana and Wyoming also use our same vaccine registry vendor. And, you know, just given up here, I mean, I know Epic and Cerner both have integration with that. So if you're in either of those other two states and you're using either of those EHR platforms and you don't have that integration, I would reach out to, you know, your IT informatics analytics department and see if maybe it's just a functionality that needs to be turned on.
Yeah. Okay, guys. Well, we promised that we would just kind of do this as in a conversational style, as the conversations and the questions kept coming. And if there's not anything else, we will give you 10 minutes back in your day. So feel free to fill out our survey that will come to you at the very end. We appreciate your thoughtful feedback and would also like to understand what works well in our webinar process and what we can do better. So please fill that out, and we'll talk to you all soon. Thank you. Goodbye.
Thank you, everybody.